Engorgement is no fun at all, and it can lead to more issues down the road if left untreated. So in this video, I'm going to share with you how to prevent engorgement and how to relieve it. I'm Bridget, and I'm a childbirth educator and birth doula, and if you're new to this channel and looking for empowerment and education, make sure you subscribe and hit the little bell so you don't miss any future videos. Engorgement happens when milk is not being adequately or frequently removed from the breasts, which results in painful swelling and overly full breasts. This often happens after birth because newborns feed at irregular times. Your milk is coming in, transitioning from that colostrum to more mature milk, which is higher in volume. You might be separated from your newborn for some reason after birth, or if you've had an IV during labor for fluids, that also might be causing engorgement too. But engorgement can also occur at any point during your breastfeeding journey. For example, when your baby starts sleeping for longer stretches at night, it might make you more engorged by morning time. You want to avoid engorgement for a few different reasons. One, it's uncomfortable. Two, full breasts don't make more milk. So if you want to keep your milk supply up, you need to express milk. Three, engorgement can make getting a deep latch more difficult because the breast becomes so firm that baby has a harder time latching around the areola. And four, engorgement can lead to more issues such as clogged ducts or mastitis, which I talk more about in this video up here. To prevent engorgement, you want to nurse your baby within the first hour after birth, and from that first feed onward, respond to baby's hunger cues so you're feeding them very often. The first couple of days, you'll just be producing colostrum and probably won't have engorgement. But as you frequently nurse, your baby is establishing a deep and secure latch, and you're learning how to hold them and get comfortable, which is going to help when your milk starts coming in because your baby is going to have a good foundation for how to nurse to build on. Mamas, you should be feeding your babies at least every 3 hours, day and night in those early days to give baby what they need to thrive, but also to avoid engorgement. Now, to relieve engorgement on top of full and frequent feedings, using massage is going to help with more milk removal. So as you're nursing or pumping, using the tips of your fingers, massage around your breast, over into the armpits even, or even up on the chest. You'll probably notice areas of your breast that are hard and bumpy, almost like you have rocks in there, and that's where massaging is going to help a lot, although it might be a little bit tender, so make sure you do it gently. You can also do this with the Lumama lactation massager, which is a great tool to help mamas have a more comfortable start to breastfeeding and a great way to help with more milk removal. It has different massage settings on it, and so it makes it really easy to relieve those engorged breasts. It actually helps stimulate a letdown, it unclogs milk ducts, and you can even place it in your pumping bra as you pump so you don't have to massage yourself. If you are a mama who is pumping a lot or you deal with clogged ducts a lot, this is a tool that I definitely recommend getting, and if you use the code BuiltToBirth20 at checkout with the link down below, it'll save you 20% off on your order. So along with massage while you're nursing or you're pumping, gentle press compressions above and around the areola will also help with draining. Now, if you are exclusively pumping, you'll definitely want to make massage and compressions a part of your pumping routine to help ensure full milk expression. If you are exclusively breastfeeding but doing some pumping to relieve engorgement, you don't necessarily need or want to fully drain the breast. You'll just want to pump or hand express, which I explain in this video up here, just to find relief. If you pump till you're completely empty or you continue to pump beyond 1 or 2 days, your body is going to keep making that same amount of milk because it thinks that your baby needs it. So only pump for relief on the breast that needs it. Another pretty cool way to relieve engorgement is to apply cabbage leaves onto the breasts. Research shows that using chilled cabbage leaves actually has the effect of less pain and can reduce hardness of the breast due to engorgement. So to use cabbage, you're going to chill it in the fridge first. You'll remove the outer leaves and then take 2 fresh leaves, wash them, pat them dry, and then gently crush the veins and then place them on the engorged breasts and then use a bra to hold them in place. Also make sure that your bra is not too tight because that can lead to clogged ducts or mastitis because compression can make it so milk doesn't flow as freely. Leave the cabbage on for 20 minutes or so, and then you can repeat this with fresh leaves every 2 hours. Once your breasts are soft enough to pump or get your baby to latch on, you should do that. Applying cold compresses can also help with the pain of engorgement, but if you're going to nurse or pump, then applying warmth will actually help release more of the milk. So you kind of want to go between that cold compress to help make the pain subside, and then use the warmth to help the milk be drawn out easier. Engorgement is no fun, and it's just one of the challenges that might be experienced during your breastfeeding journey that might cause you to doubt in your ability to breastfeed. Oftentimes, women cut their breastfeeding journey short because they don't know that there can be victory over these challenges. But mama, you are made to do this. The Built to Birth postpartum course teaches you how to overcome common postpartum challenges so you can be a more confident parent. You can check it out down below in the descriptions. You are not alone in these challenges, mama, and if you're needing some encouragement, comment down below so myself or another mama can encourage you, and then find another mama's comment that you can encourage her about. Thank you so much for being with me in this video, and I will see you in the next one. Bye, mamas.